Hi, this is Dr. Jin Sung, and welcome back to Thyroid Success Secrets number 10. Thyroid Binding Globulin. When thyroid hormones are secreted from your thyroid gland, they're bound to a carrier, a protein. The protein is called thyroid or thyroxine binding globulin, or TBG. So TGB is similar to a taxi cab, and your thyroid hormones, T4 and T3, get into the cab, and they are transported from your thyroid to the liver or gut, where they are converted. And then they jump back into the cab once it's converted, and they're transported to the rest of the body. You have these little carriers going everywhere and anywhere inside your body, so your metabolic rate can occur. Trouble occurs when there are so many of these carrier proteins called TBG, these little taxi cabs, that the normal free T4 and free T3 that should be floating around or circulating around is no longer circulating. They're in this taxi cab. It's as if they get all sucked up by this big sponge, by all these little taxi cabs, these thyroid binding globulins, that they cannot function at the receptor site. Here's the thing. Your TSH will look normal. Your total T4 will look normal. Your total T3 will look normal. If those are the only markers that your doctor is checking or running, then the problem can be completely missed. This is why you need all of the thyroid tests done, not just the TSH or the total T3 or total T4. You need TSH, resin T3 uptake, free thyroxine index, reverse T3, and the thyroid antibodies. In addition to the thyroid binding globulin, free T3, free T4, and a total T4 would be helpful. If thyroid binding globulin is too high, even though your TSH is normal, including T4 and total T3, your doctor needs to check something called T3 uptake. It will show that actually the T3 uptake is low when thyroid binding globulin, or TBG, is elevated or high. Remember, the reference lab or lab reference ranges for T3 uptake is extremely broad, where the optimal or functional range is much narrower. Excess estrogen is the cause of most elevation of TBG, or thyroxine binding globulin. Birth controls contain estrogens. Some face creams and cosmetics contained undisclosed amounts of estrogens. And these estrogens can elevate your body and can elevate in your body, and they're detoxified through the liver. So imagine if you had a poor liver function, or the inability to detoxify and your liver is not doing that. This is yet another reason why you could have thyroid type symptoms, because your liver is dysfunctioning. It's not converting the T4 to T3. It's not necessarily a problem of just the thyroid gland itself, but more a problem of the liver. It is important to realize that there can be many more causes of thyroid malfunction, more than just my TSH is low. Again, we want to do all the testing, get to the root cause of what's happening with that patient. If thyroxine binding globulin, or TBG, is elevated, you could have low thyroid symptoms, but your normal lab markers or numbers may be considered normal, even though you're on thyroid replacement therapy. My name is Dr. Jin Sung, where clinical excellence meets excellent results. We'll see you on the healthy side. Thank you.